Anyway, let me just start off by saying, how many people feel that if they were to share Christ with their patients, that there would be some resistance in their organization? Okay. So if you were to engage patients on a spiritual level, there might be some resistance, or at least you worry about it. Has anybody ever been told that they should not engage with patients on a spiritual level? Has anybody ever been told that? Okay. So the goal of this talk is really simple, actually. It's actually a very narrow focus. This is one tool that can be used to allow a Christian healthcare provider to justify engaging patients on a spiritual level. So the purpose of this is twofold. One is, if somebody sees you engaging patients on a spiritual level and asks you to justify your behavior, you will be able to do so from a literature perspective. Okay? The second is, this is somewhat detailed enough that if you decide to give a talk at some point to your colleagues and attendings, that hopefully this will provide a good start for doing so. So, again, the goal is not just for you to feel a little bit more comfortable, give you a tool to defend yourself, and justify engaging patients on a spiritual level. But also, there's enough literature in here that I would hope that you'd be able to talk to your attendings and to your colleagues about spiritual issues. Okay? There's a couple things about what this is not. This is not a justification for why Christian healthcare providers engage patients on spiritual things. That comes from the scripture. So on the handout I have Matthew 28, and that is the only reason needed. We don't need the literature to tell us that we should share Christ with our patients and the people around us. In no way does this even pretend to tell you what it means to be a Christian physician, a Christian healthcare provider in any way, much less the totality of what it even means to be a Christian witness. This gives some evidence reviews, some tools that can be used. And I always think about, I shared this the last time I spoke, I always think about two people I met, MacNeil and Dove, who were housekeepers at a hospital I worked at, who after being there in residency, I found out that they would just go room to room, cleaning rooms and witnessing to patients. And not just witnessing to patients, but witnessing to attendings. I think one of the temptations in a healthcare fellowship is to think that there's something unique about healthcare that allows us to witness to patients. And while that is somewhat true, what allows us to witness to patients is God's grace giving us opportunities and our humility and our faith in making the most of those opportunities. And in all reality, that's all we need, fueled by prayer. But this is also not to tell you that this is the most effective way of being a verbal witness. Being a verbal witness, I think, in a healthcare setting really changes depending on what specialty you are, what setting you are. I shared this before too. My dad's a radiologist. I think somebody would be very surprised if after they got a chest x-ray, the radiologist came out and said, well, are there any religious or spiritual concerns that you would like to address with me today? So it's going to change depending on the setting, how ill somebody is, and what specialty you are. The other thing is, this is not necessarily the best way to defend your actions or justify or even get the leeway and freedom to share Christ with your patients. To me, without any question, being a good student, a good healthcare provider, being responsible, being a good learner, being kind to the people around you, if you're not getting your other work done and you're trying to do something that's sort of frowned upon within your institution, you're going to have a hard time. If you're a good student, you're a good learner, you're a good worker, you're responsible, people will cut you more slack to do the things that you want to do. So this is not meant to even be the most important reason why you can tell somebody about why you're sharing Christ. I mean, your Christian witness is going to do that. A couple more caveats. There's nothing in here about efficacy, that religiousness or religiosity leads to improved health outcomes. The reason for that is because there are over 30,000 articles in PubMed dealing with religion. It's a completely different set of literature. The literature that I'm reviewing is about why we should engage patients spiritually. It's a completely different set of literature to say that religiosity leads to improved health outcomes, whether it's longevity, decreased hospitalizations, improved coping skills, whatever. It's a completely different set of literature. They tend to be cohort studies. Methodologically, that's very difficult to interpret. It's very controversial, and it would be a whole week-long talk in and of itself. The other thing is, I don't really care about efficacy. I don't really care if the literature says that religiosity leads to better health outcomes, because I don't believe in a health and wealth gospel anyway. And the other thing is, I don't really want health outcomes linked to religious behavior. You know, it's not prayer intrinsically that brings healing to people. It is God through prayer that brings healing to people. And trying to separate religious behaviors from God and then say these religious behaviors are associated with health outcomes, I don't think does a Christian witness really a whole lot of good. I mean, we believe that God himself is what brings healing to people, not just going through the motions of praying, church attendance, and so forth. So the way I want you to use this is that, again, in some way, this may be a tool to encourage you that if you engage patients on a spiritual level, you are practicing standard of care medicine no matter what type of healthcare provider you are, and you're well supported in the literature to do so. I want you, obviously, to continue relating to patients spiritually. The Great Commission stands each day you live. There are tools in here, both spiritual screening tools and spiritual history-taking tools, that even though they're written in the secular literature, I think are really good starting points for the Christian physician or person, student, anybody, to even just broach the subject. Sometimes when you don't even know how to start a discussion on spirituality, having a couple of canned statements ahead of time that are acceptable is a really good place to start, because then you're not having to make something up yourself, worrying about how it's going to be received and so forth. Hopefully you can read this and then summarize it and be able to give somebody a very quick answer if they say, why are you talking to people about spiritual things? And you can actually, if you look at the very first page of the bibliography, I give you a URL, or you can actually download this handout as a Word document. Feel free to modify it, stick your name on it, use it for whatever you feel. And the PDFs of the articles are also in this folder. So that way you don't have to go searching through PubMed, and your institution may or may not have access to all these journals, etc. Any questions? Yeah. Okay. So first of all, I bit off more than I could chew, in the sense that the literature just seems to go on and on and on about this. And so these articles aren't necessarily, as much as I try, there's literally thousands of articles about engaging patients spiritually. So these journal articles are meant to give you a flavor of what the literature says, so that you can feel that if we're telling people at church, we're telling you guys at church to engage patients spiritually, your hospital is saying, well, why should you do that? You know, we don't do that at our institution. This is an attempt to try to bridge that gap. This is an attempt to bridge the gap between what we're telling you at church and something that will help you engage and sort of engage in communication with people where you work on a very medical and scientific level. So I start out by just talking about how patients are religious. Okay, this is how a lot of articles on religion and medicine start out. These tend to be done by Gallup polls, Time Magazine, CNN, USA Today, those type of broad polls. Basically, it says that 95%, you'll see varying statistics between 90 and 98% of people believe in God. 90% of patients, Americans, say they pray. Most patients attend religious and religious services, whether it's at church or synagogues. And most patients believe that religion can help them recover from an illness, injury, or disease. So within each box is the actual article, and so you can always look up some of these things yourself. There's this guy named Dr. Sloan from Columbia who's not a happy camper when it comes to discussing religion with patients. But even in his articles, he recognizes that patients are very religious. And interestingly, patients tend to be more religious than physicians, okay? So even from a cultural sensitivity perspective, even if the physician isn't religious and patients are, it's a cultural gap that's worth discussing and bridging. I'm a geriatrician, so obviously I have a cultural gap with all my patients. They're all older than I am. But again, just in the cultural differences context, this is an important gap to at least acknowledge and consider. There are actually quite a few studies talking about patients wanting physicians to engage them in spirituality. So one justification always is that if a patient brings it up, you're free to engage them. It would be almost inconceivable to find a situation or a person that would say that a physician, that a patient brought up spirituality, saying, I'm really struggling with this spiritually, and a physician just says, you know what, that's not my job, deal with it on your own. You won't see any arguments or any articles where that's a justified behavior, okay? So one key is, if a patient brings up spirituality, that is your blank check to discussing it, no matter how hostile the environment, because the patient brought it up. It's patient-centered medicine. So a lot of these studies are done in different settings. They're done in outpatient family practice settings, outpatient pulmonary critical care settings, inpatient settings, rehab settings. I didn't see any in nursing home settings where I practice a lot. But in all cases, there's going to be a certain percentage of patients who want their healthcare providers to engage them on a spiritual level. The healthcare provider is not, and the patient is dissatisfied as a result. Again, so I'll give you an example. In the first study, which is done by Dr. McCord, they did it 1,400 adults in an outpatient residency training sites, 4 residency training sites, 1 in private practice. 900 patients completed the survey. It depended on what the situation was. So this was a hypothetical question. Would you want your physician to ask you about religious things in these different scenarios? Minor medical problem, routine physical, initial visit, if admitted to the hospital, if diagnosed with a serious illness, and if possibly dying. And you can see that the rates range from 22% to 94%. The reasons patients wanted to be asked is for better physician understanding, in case of a life-threatening illness or serious medical conditions, and because they lose a loved one. The outcomes that the patients are looking for is for the physician ability to encourage realistic hope, to actually change the medical advice, to change the medical treatment, and so that the doctor would pray. So a third of the patients wanted their physician to engage them on a spiritual level, so that way the doctor would pray with them. One of the more widely quoted studies, skipping to the third page, I guess, is one by Eamon. He's actually the chaplain at Presbyterian Hospital, and he and I see each other all the time. And in the pulmonary critical care outpatient clinic at Presbyterian Hospital, they handed out a survey. They got about 177 patients to respond to this. So this was a contextualized question. Would you want your physician to inquire about religious or spiritual beliefs if you were gravely ill? Okay. And the majority of patients said that they would, and that a certain percentage of patients would even want to engage in prayer with their physician. 2/3 of the patients said that it would increase trust with their physician. Out of the patients who said that they would not want to engage their parents on a spiritual level, half said that they would still want to be asked.